It gives me great pleasure today to introduce to you a young lady that's really involved in an area that for us on the continent of Africa is obviously something that's a central concern of our time. She is what I consider to be an activist in the area of HIV and AIDS. Benedicte, or Nina, she prefers to be called, is someone that is playing a very active role on the continent in ensuring that she not only destigmatizes the issues of HIV and AIDS, but actively campaigns for women living with AIDS and ensuring that there is not only education but communication to remove the stigma around the disease. But she's also involved in many ways in other areas that focus on issues of health, HIV/AIDS being the main one. In talking to her, she told me that she's very passionate about making a difference in the area of HIV and AIDS because she believes that the disease has transformed her. And like most of us, she understands that the disease affects all of us. You either know someone who is infected or you know someone that is affected by the disease. So she works very closely with communities in her native homeland of Côte d'Ivoire or Ivory Coast, based in Abidjan, although she tells me that she was born in Mbwake. Now, she's also involved with the Coalition for Access in terms of access to medication. She also works on the drafting committee for UNAIDS that focuses on that specific subject. And she is a student, and I asked her, where does she find the time to do all of this? And she says, you make the time. That just goes to show you how passionate she is about what she's doing. And lastly, a point that was of interest for me is that she studied social linguistics. And so I was trying to make the connection between linguistics and what she's doing. And I think she made a very clear explanation to me that social linguistics is about how language works in society. And therefore, to destigmatize HIV/AIDS means that you need to ensure communication and better understanding of the communication imperatives in any society. So now I could understand where the link comes from. But without further ado, ladies and gentlemen, let me introduce to you Benedicte Kouassi. Thank you.
Thank you for the introduction. I feel like a star. Since I've been introduced like a star, I want to pose. Please, read what is written on my read what is written on my T-shirt. Can you read it? On the back? Can you read it? Yeah. Thank you. This is what I'm going to talk about today. Today, there are 33 million of people living with HIV. 23.5 million of them live in sub-Saharan Africa, where I come from. In the last 30 years, great treatment progress has been made. New microbiicides help prevent HIV, and antiretroviral drugs help people live longer. So that today, in the US, in that country, if a 25-year-old young individual discovers he's HIV positive, if he goes to the hospital, the doctor prescribes treatment and is likely to live 50 additional years. 50 additional years. This is incredible, isn't it? Unfortunately, not all people living with HIV benefit from these advancements. Only 54% of people living with HIV in the world who are eligible for treatment are receiving it. You may ask why, and I'm wondering why. Why? This is only because most of people living with HIV come from countries with very limited resources. They come from countries which are poor, if I may say. So today, there are 9 million of people who are waiting for treatment. Guess what it means? 9 million of people are waiting for treatment in the world. And even if treatment is free in some countries, for instance, in my country, treatment is free. other costs related, such as HIV testing, transportation to health facilities, prevent people living with HIV access treatment. And these costs are also a major barrier for young people living with HIV, because these young people, they struggle on themselves. They are trying to find someone to sustain their lives, so they cannot afford these costs. And patients simply cannot maintain treatment. And the other issue is the issue of drug stockouts. Drug stockouts. In some countries, there are drug stockouts. That means people cannot maintain treatment. And guess what it means for someone who is on treatment to interrupt his treatment for a lapse of time? Guess what it means? So I believe that these are challenges that need to be overcome to provide HIV patients access to optimal and better treatment. This is what my organization, the organization I'm working with, the International Treatment Preparedness Coalition in West Africa, tries to achieve. We advocate for optimal drug regimens, and we campaign against drug stockouts. Our youth programs use social media and blogs to educate young people with HIV about treatment literacy and adherence. One issue we also try to address is stigma. Yes, stigma. In many countries, people living with HIV face widespread stigma, and they face prejudice because they live in communities that still misunderstand HIV and blame those who have it. So patients, they had their illness, they skip their drug, they don't adhere to treatment just because they want to keep this hidden. They don't want people to know that they're HIV positive. As a result, they're more likely to infect people around them, and they're more likely to pass the virus. So we are trying to address the issue of stigma. And so far, with our organization, through anti-stigma campaign, we have empowered 50 positive women. And guess what these women have been doing? They've told their husband, look, I'm HIV positive. And this is very, very great, because they have been, as they just told us, okay, you're HIV positive, it's not a problem for me. And they took their medication openly. Today they are free about the issue of HIV. They can tell everybody, I am HIV positive. And this is a great issue. We also empower people living with HIV by providing grants. Today, we have provided grants to 20 women living with HIV to develop income-generating activities so that they can afford their treatment costs. We have also founded 6 shelter housing for 50 young people with HIV. They are educated about treatment, adherence, safe sexuality, contraception, and reproduction. We'll also campaign for access to generic products, pediatric, less toxic drugs, which are more easily available elsewhere in the world, unfortunately not in sub-Saharan countries. You may ask why I'm focused on treatment, but this is because I'm committed to achieve universal access to treatment for people with HIV, because I believe that people with HIV need and they deserve quality, affordable treatment to live longer, healthier, and productive lives. And I think this issue can be achieved. We can achieve access to treatment if reliance on donor countries is reduced, if each government owns its national health response by increasing the budgets to health, and if they support greater access to generic versions to drugs, which are cheaper. Then the UN's goal to put 50 million of people eligible to treatment under treatment by 2015 can be achieved. So what I'm going to tell you is just to remind that since 30 years, we have lost 30 million of people because of AIDS. Guess, is it enough, or should the numbers continue to increase? This is what I want to think about. Thank you.